Quitting smoking is a significant undertaking. It's a journey that requires commitment and resilience. Many smokers try to quit multiple times before they succeed. This is completely normal. Don't be discouraged by past attempts. See them as learning experiences. Each attempt teaches you something valuable about your triggers and habits. Use this knowledge to create a stronger plan for your next quit attempt. Remember, millions have successfully quit smoking. You can too. It's crucial to approach quitting with a well-thought-out strategy. This is not about willpower alone, it's about understanding the addiction, utilizing the right tools, and building a support system. This essay will explore the latest methods to help you navigate this journey successfully. With the right approach, you can break free from smoking and reclaim your health. If you found this information helpful, please like and subscribe for more tips on quitting smoking and living a healthier life. Nicotine is a highly addictive substance. It affects the brain by releasing dopamine. Dopamine is a neurotransmitter associated with pleasure and reward. This is why smoking can feel pleasurable, especially initially. Over time, your body and brain become accustomed to nicotine. When you try to quit, you experience withdrawal symptoms. These can include cravings, irritability, anxiety, difficulty concentrating, and increased appetite. Understanding your triggers is key to managing cravings. Triggers are people, places, or situations that make you want to smoke. Common triggers include stress, social events, alcohol consumption, and even finishing a meal. By identifying your triggers, you can develop strategies to avoid or cope with them. This might involve changing your routine, finding healthier coping mechanisms, or learning to say no in social situations. Setting a quit date is an important step in your journey. It gives you a concrete goal to work towards. Choose a date that is near enough to maintain momentum. However, ensure you have enough time to prepare adequately. Use this preparation time to gather your resources and make necessary changes. Talk to your doctor about your quit plan. They can provide guidance and recommend appropriate cessation aids. Start reducing your daily cigarette consumption gradually. This will help your body adjust and minimize withdrawal symptoms. Begin practicing stress reduction techniques. Mindfulness, deep breathing, and exercise can help manage cravings. Inform your friends and family about your quit date. Their support can be invaluable. Consider joining a support group or seeking guidance from a therapist. Section 4. Modern Tools for an Age-Old Problem, NRTs. Nicotine replacement therapies, or NRTs, are medications that provide controlled doses of nicotine without the harmful toxins found in cigarettes. They help reduce withdrawal symptoms and cravings, making it easier to quit. NRTs are available in various forms, including patches, gum, lozenges, inhalers, and nasal sprays. Patches provide a steady stream of nicotine throughout the day. Gum, lozenges, and inhalers offer more immediate relief from cravings. Each form of NRT has its pros and cons. Talk to your doctor about which option is right for you. They can recommend the appropriate dosage and duration of use. NRTs are most effective when combined with behavioral therapy and support systems. They address the physical aspect of addiction, while behavioral interventions target the psychological and habitual components. Section 5. Prescription allies in your journey medications. In addition to NRTs, certain prescription medications can assist with smoking cessation. Two commonly prescribed medications are varenicline, also known as Chantix, and bupropion, also known as Wellbutrin. Varenicline works by reducing the pleasurable effects of nicotine. It also blocks the rewarding effects of smoking, making it less appealing. Bupropion is an antidepressant that has been found to reduce cravings and withdrawal symptoms associated with nicotine withdrawal. It's important to note that prescription medications can have side effects. Consult your healthcare provider to discuss potential risks and benefits. They will determine if these medications are appropriate for you based on your medical history and individual needs. Section 6. Beyond willpower, therapy and support systems. Quitting smoking is not solely about willpower. It's about addressing the physical, psychological, and social aspects of addiction. Behavioral therapy plays a crucial role in this process. Cognitive behavioral therapy, or CBT, helps you identify and change negative thought patterns and behaviors associated with smoking. It equips you with coping strategies to manage cravings and triggers effectively. Support systems are invaluable during your quit journey. Surround yourself with people who encourage and support your smoke-free lifestyle. This could include family, friends, support groups, or online communities. Don't hesitate to seek professional help from a therapist or counselor specializing in addiction. They can provide individualized guidance, support, and coping strategies tailored to your specific needs.